Social distancing is considered essential for slowing the spread of COVID-19. As the infection advances across the country, more and more Americans are being urged to stay at home. But isolation can be devastating for those suffering from depression and suicidal thoughts. Here to discuss is Dr. Jeffrey Kassinove, psychologist and co-founder of Therapy West. Doctor, it's good to see you, at least virtually, through the screen right now. I know a lot of people, maybe especially over the holiday weekend, use technology to connect with each other when we aren't able to physically be with one another.
Yes, it's great to be on the show. Thanks so much. I think it's been a struggle for all of us. Mental health professionals are really trying hard to get into the homes and to use the virtual formats like Zoom and other platforms to help the people, throughout the United States that have a lot of mental health needs.
Well, it's good to hear that the professionals are using, I guess, telemedicine would be a way to kind of connect with patients as well, as we are kind of learning how to operate Skype and Zoom and FaceTime all together. Doctor, a majority of Americans are in isolation right now, and everyone is kind of racing to get back to their normal lives. But once that point comes, do you think any psychological effects will linger from, again, being separated?
Well, certainly, I think that this separation has been really hard. People are having a lot of active kind of post-traumatic stress kind of syndrome, and right now they're in the stress. So I think afterwards we're going to see a lot of PTSD, and we're going to have to help a lot of people kind of get through that and get us back to when there's more of a normal experience that we're having.
Are you hearing from more people who might become depressed during this time or become more anxious?
So certainly, this isolation that's going on and all of us being asked to be at home is causing a lot more, greater increase in mental health disorders. I'm hearing it certainly even with my own colleagues and family members that it's really been a tremendous distress. This is a risk factor. This is a big environmental change that's increasing the risk of people to have depressive symptoms, and we're concerned about it.
Do you think this will be a lasting effect on this generation for those of us who will have lived before pandemic and then post-pandemic?
I certainly hope not. I'm pretty optimistic, and I think that human beings are really able to be resilient. And I think over time, the memory of this experience, I think, will look at it as something that we were able to endure and look at it as a positive outcome and how we kind of do things in the future. So I actually think that in some respects, as things change, it will actually be an opportunity for us to kind of have a little bit more resilience.
Well, I hope so. And, we are seeing a lot of people being very resilient right now, especially in cities around the world. They're coming together on their balconies, clapping and singing as a sign of solidarity in the face of COVID-19, as we've seen abroad and in New York as well. For instance, they do a citywide applause every night for first responders, nurses, and doctors who are fighting the outbreak, of course. But after traumatic events like 9/11, widespread mental health problems could grow for months, as we saw. So what do you think might happen when all the clapping stops? Is there a way that we can come together and support each other then?
Well, I think that really the important piece is what we're doing now is we're really trying to ensure that people create a lot of structure in their life, that they are engaging in, nightly getting on Zoom calls and communicating with other people and connecting, because we are social creatures by nature. And when we have too much social distance and isolation, it can lead to mental health disorders. So we really want to make sure that people are maintaining a lot of structure, connecting with people. If they're alone, that it's really important that their friends and family reach out to them and they reach out to them, in the other direction, and that it's consistent, because we are concerned that the COVID-19 virus and this pandemic is really a major risk factor for mental health issues.
Yeah, it's a good time to pick up the phone and make the call. That's Dr. Jeffrey Kassinove, psychologist and co-founder of Therapy West. Doctor, thanks for joining us.